All right, Zakiya, you ready to get started?
Yes, let's take a look.
Okay. How do you actually take Ruconest? I know it's injected into a vein. Well, that's right. It's injected into the vein. It's an IV injection that uses a butterfly needle and it goes into your vein. And it's about the size of a mechanical pencil, the lead in the mechanical pencil.
And that's right. When you inject, you only inject Ruconest over 5 minutes. And you do it in the comfort of your home and you don't have to go anywhere special. So let's go with the next question. IV injection sounds complicated. Can I really do it by myself? Absolutely. If you don't feel comfortable in the beginning doing it with yourself like I was very nervous. I contacted the patient advocate and she came out and she made sure that she did not leave my side until I felt comfortable enough to do it by myself. And it was the amazing experience. Like from then, the more I did it on my own, the more I became comfortable. And that's the great thing about Ruconest solutions.
All right. What happens if I forget how to do the IV injection? Well, the great thing about the IV injections and the Ruconest patient advocates is they're always there for you. Well, and once you begin doing this, I really feel like you really become like second nature and you really don't need them as much the more you do it.
Yes.
Now, on to you.
Okay. I'm worried about being able to find a vein. Like, I get it, in the beginning, you don't really know what are you looking for. Like, how do I find a vein? Over time, you do become comfortable and you learn where your veins are in your body.
Yeah, and they also have a great tool that you can utilize called the Vein Finder.
Yeah, absolutely.
And if you need it, it's there for you and it helps you find your veins when you think you're having difficulty with it.
Yes.
All right. What if my veins aren't healthy enough? I think that's a huge misconception. Your veins can be healthy enough. You just need to take care of yourself and take care of them.
And also the alternation of your veins, like making sure you don't use the same vein every single time. Making sure you use your hands and your arms and making sure you know where those veins are. That is very key into having healthy veins.
The Ruconest patient advocates do a great job of giving you strategies to allow you to hit those veins a lot easier. So they gave us these squeezy rocks. Did you get one of those?
Yes.
And you can squeeze it when you've got your tourniquet on. They also provided these hot packs.
And the water bottles.
Yes, and water bottles because staying hydrated is key to healthy veins. Yes. All right, Zakiya. Are you ready?
Yes. Why should I consider Ruconest? Well, I consider Ruconest for 2 reasons. It is plasma-free and it is a C1 inhibitor. And as we know, HAE is a C1 inhibitor deficiency. So that allows for the medication to replace what I'm deficient in.
When I first see the sign of a swell coming on, I take Ruconest and it gets into my bloodstream immediately, and that's where I need it because we have a C1 deficiency in our bodies.
Yes, so guys, trust me, this whole process with Ruconest and IV injection, if you have any issues, just know that your patient advocate is there for you from the beginning. When you first get your medicine all the way through the whole entire process, they are there for you. Reach out to them.
Ruconest is an injectable prescription medicine that is used to treat acute attacks of hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12. Important safety information. Do not use Ruconest if you have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis, to Ruconest or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums turning blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use Ruconest if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of Ruconest. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events, product complaint reports, and medical information, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.